There's one morning when I wake up on the bed, so I feel that my heart beat very fast. So I feel very uncomfortable at the chest. So I told my wife, and she felt my pulse. She said that it's something not right. So send me to the hospital immediately.
I was only alerted through the smartwatch. Staff prompted me to seek medical attention when she saw the readings of the mobile ECG.
When I in A&E, so they arranged me to go to have a CT scan and this 2D echo test to find out the cause. So from there, then I know that, okay, I'm having this atrial fibrillation.
I'm a caregiver to my parents who both have atrial fibrillation. In my mother's case, there wasn't any signs and she had a stroke. It has changed her life and the family's life.
First time when I heard that I'm having an atrial fibrillation, and then as a layman, I do not know what is the atrial fibrillation. I feel like it's frightening. It's never before, you see. All the while I'm so healthy, and then come suddenly that having this issue.
It was during the hospitalization that they found out that I actually had atrial fibrillation. I was monitored wirelessly. So during that period of time, they could see that I had fast heartbeat, erratic heartbeat. And the nurse would pop the head into the ward and ask me whether I felt anything. I didn't feel anything. I felt very fine. I was very normal.
In my father's case, he was diagnosed about 3 years ago. We felt more of a sense of a relief because he was diagnosed early. It was during a polyclinic checkup. They've realized that his heartbeat was beating very fast, and that's where they did an ECG and realized that he has atrial fibrillation. And he could take the necessary precautions and the medications before a stroke strikes him.
During the time, my BMI is about 22.5 to 23.5. So when the doctor advised me, said that, okay, you got to cut down because according to your height and all this, your BMI is too high. You try to maintain below about 21 like that. Because fibrillation, if you don't take care of it, so it will develop a blood clot. So it's a blood clot when travel to the main artery, so you will get stroke.
During the blood test, my blood vessels were clear. There was no blockages. I don't have diabetes. I don't have cholesterol problem. In my case, the doctor couldn't find anything except that it's due to old age that I get AF. I was, of course, in the beginning quite puzzled, and over time I learned to accept it.
For my mother's case, I think having the stroke, a severe stroke, is a life-changing event. So before her stroke, she was able to go to the market by herself. She does marketing 2 or 3 times every week. She's able to go about her social life independently. Right after the stroke, she had difficulty speaking. In fact, until today, she cannot talk at all. She has to learn how to feed herself with her non-master hand. She has to learn how to swallow. So a lot of intervention by therapists, such as a speech therapist, a physiotherapist, and an occupational therapist. In the initial days, right after the stroke, when she was home, she displayed a lot of mood changes throughout the day. I remembered an occasion where she didn't want to have her food for the whole day. So the family was worried. We saw her crying the whole day. So together with my siblings, I have 2 other sisters. We helped her to overcome some of the daily obstacles. One of the things that we did with her was to try and understand what she was trying to tell us each time, because currently she can't speak at all.
I decided that I should change my lifestyle and eat even more healthily, exercise more at the gym or even at home. After coming here to exercise at the Singapore Heart Foundation gym in Bishan, I gained confidence and I am able to use the machine independently. I'm also able to overcome my pain and manage my pain from the advice given by the resident physiotherapist. And I realized that exercising actually is keeping me healthy and help me to maintain my active lifestyle.
After putting the pacemaker, I feel that is very good. I don't feel that this giddiness anymore.
For my father's treatment, it's relatively simple. So he sees the cardiologist once every 6 months. So his treatment is some drugs that helps to contain or slow down his heart rate. It also consists of a blood thinner that helps to thin his blood. The consistent consumption of blood thinners, as explained by the doctors, has helped to keep him in good shape and to prevent a stroke from happening to him. Largely, he is living life as per normal.
Based on my own experience, you may not feel anything during the episode of AF. Hence, it is important for you to take control of your health and exercise regularly, eat healthily, go for your yearly medical checkup.
We should go for our blood tests and the heart scans on a regular basis so that the doctors can monitor the status of our heart regularly and detect any abnormalities that may be of concern early.
Try to plan your work advance, is not to stress yourself. But the most important thing is got to sleep early. When there is opportunity, you got to let your body rest.
I think everyone should be aware that a person with atrial fibrillation may have a stroke multiple times. They should take preventive steps to minimize that from happening, and that may include adhering to their medication. I do encourage my friends around me to learn about atrial fibrillation, to learn about the risk, and to learn about how to respond when we encounter a case of a stroke. If you find that the person's face, F, is drooping and his arms are weak on one side, the speech is slurring, it's time to call the ambulance at 995. So FAST, remember.